All right, let's get to it. Did I miss the coronavirus? I mean, the chloroquine headline? No. Here's what the FDA had to say in a thing that was put out this week. FDA cautions against use of hydrochloroquine or chloroquine for COVID-19 outside of the hospital setting or a clinical trial due to risk of heart rhythms. Heart rhythm problems. We've been hearing about this, right? Well, what about the heart rhythm problems? When I talk to my friends that are in liberal states, they all are really on top of this heart problem. Other people that tend to be watching Fox and things are saying, oh man, I have a friend that was saved by a hydrochloroquine. It was really great. It's so bizarre and such a clear divide. But what was fascinating is it was a divide from the very beginning. I want to go back to, I think it was about 5 weeks ago when we played you a video. How does divide start? And how has it affected these discussions? This is what I want to talk about today. Take a look at 5 weeks ago. This was Trump and Fauci talking about hydrochloroquine.
The media seems to enjoy looking for the tension between you and the president.
A drug called chloroquine, and some people would add to it hydroxychloroquine.
Today, there are no proven safe and effective therapies for the coronavirus.
This has been prescribed for many years for people to combat malaria, which was a big problem, and it's very effective. It's a strong drug.
You've got to be careful when you say fairly effective. It was never done in a clinical trial. They compared it to anything.
It's not like a brand new drug that's been just created that may have an unbelievable monumental effect, like kill you.
We're trying to strike a balance between making something with a potential of an effect to the American people available at the same time that we do it under the auspices of a protocol that would give us information to determine if it's truly safe and truly effective.
It may work, may not work. I feel good about it.
The president feels optimistic about something, his feeling about it. What I'm saying is that it might be effective. I'm not saying that it isn't.
I'm not being overly optimistic or pessimistic. I sure as hell think we ought to give it a try.
The information that you're referring to specifically is anecdotal. It was not done in a controlled clinical trial.
Let's see if it works. It might and it might not.
There's no magic drug out there right now.
Okay. We're going to see what happens. We have nothing to lose.
You really can't make any definitive statement about it.
You know the expression, what the hell do you have to lose?
So today we're talking about that divide in the nation, right? How we're all divided, and this is really where it began. If you haven't been aware of this, there were really two teams that then split off, right? You had conservatives that started reporting on all of the success of hydroxychloroquine all around the world. We started hearing from doctors on Fox all the time saying, oh my God, I've cured so many patients. This is amazing. On the other hand, you had those that seemed to be behind Fauci saying, Fauci said it doesn't really work. CNN, MSNBC, we can't trust this drug. We all got to wait for the vaccine's the only way out. The vaccine's the only way forward. 18 months from now, we've got to be locked down. And so this is where that divide really begins, isn't it? And it's quite odd that, and I've said it before, why didn't Fauci believe there could be a drug, a miracle drug? He believes there's a miracle unicorn vaccine out there, meaning something that doesn't exist on the planet. He doesn't want to seem to believe that something that exists now really works. And now they finally have their moment, right? The FDA's come out. And what did we see from all those same channels? If you've been watching liberal media, then you've been afraid of hydroxychloroquine, and now it's your victory dance. It looks like this.
A major setback in the hopes that the drug hydroxychloroquine could be used as a possible treatment for coronavirus. A clinical study indicates the drug touted by President Trump does not work.
The findings appear to be pretty significant and concerning. And so when you put this in conjunction where we found that those that were treated with the hydroxychloroquine had higher mortality rates and higher rates of going on ventilators.
Where is the evidence that they're using to determine that it's safe to continue? When we've got this study, we see no other evidence coming out that it is beneficial.
So here's my question to you. When you watch that moment with Fauci and Trump, is there a bias there? Do scientists have a bias? Are there things that they care about more than others? Do scientists tend to see what they believe? Does their bias affect how they look at their research? I mean, these are things that we are all going to have to really start to get more hypercritical of and focused on. Because remember, you have about 100 drug companies now, all in the amazing race for a $750 billion product. That's what that vaccine could make. Bill Gates is saying he wants to give it to 7.5 billion people, and at about $100 a pop, we're guessing that would be a very cheap vaccine, $750 billion to be made. So is the bias, since the manufacturers are the ones that do their own study, is there a bias that's going to affect maybe problems that they have, maybe things that they do, how they handle that study, right? That's what I want to discuss with you. Do you think that Dr. Tony Fauci has a bias, especially as after I was on the show just a couple of weeks ago pointing out to you that the NIH under Dr. Fauci knew that they'd done a study all the way back in 2005. This was a huge breaking story in which I showed you all the way back in 2005, they knew that hydroxychloroquine was effective against the SARS coronavirus, and we could have had to jump on it and maybe been the first ones in the world to really discover it because we were already on it. That wasn't what we did. Instead, Fauci was saying, no, I don't really trust it. And I said, I think blood will be on his hands for all those that died. Now, whether or not he heard what I said, or whether or not I was being overly dramatic, you have to imagine that he does see if it ends up being a successful drug, and he clearly tapped the brakes on it as we were moving forward. A lot of people, and Cuomo listened to him and didn't make it immediately available, then a lot of people might have died that could have been saved. I'm just saying, are you with me? Am I over-exaggerating, thinking there's a bias there to make sure that Trump is wrong and that I was right, because I could get into some hot water and it will look really bad. Also, it'll really mess up my vaccine program. Well, this was the headline as we saw it in Fox. Now let's get down to it. I want you to look at it through those eyes. COVID-19 treatment, hydroxychloroquine showed no benefit. More deaths in VA virus study. This was a study in the VA. They said there was more people died that got hydroxychloroquine than those that didn't. But let's take a quick look at this, shall we? This is from MedRx IV. This is one of the comments coming from the study itself. Let's take a look at what they had to say. Outcomes of hydroxychloroquine usage in United States Veterans Hospital with COVID-19. This is one part of it that, however, hydroxychloroquine with or without azithromycin was more likely to be prescribed to patients with more severe disease, as assessed by baseline ventilatory status and metabolic and hematologic parameters. Thus, as expected, increased mortality was observed in patients treated with hydroxychloroquine, both with and without azithromycin. So what they're saying is, look, our study has certain limitations, including to those inherent to all retrospective analysis, such as a non-randomization of treatments. We didn't randomize this study. Our findings may also be influenced by the demographic composition of patients in our cohort, the majority of whom were black. Disproportionately higher rates of COVID-19 related hospitalizations among the black population have also been reported in the United States as a whole. What are they saying here? Right here, they're saying in the study, there is going to be this slight problem. We only gave hydroxychloroquine when you were about to die and were being ventilated. You were already in really, really bad shape. So, as it would turn out, if you looked at overall cases, those who were getting hydroxychloroquine were more likely to die anyway. So there is a chance our study could end up showing you that hydroxychloroquine caused higher death rate, when in fact it was just that we gave it too late. Oh, and by the way, we really are only looking at the most susceptible population there is, African American men over the age of 65, with other issues. This is one of the worst studies you could ever imagine. It is a total disaster. And on top of that, we looked into the study. We found not only did they take people that were only getting this drug right at the last second, which is, by the way, that's what you read into when you looked how Andrew Cuomo wanted to use it, right? Only in hospitals, only really in emergency situations. So not right as Didier Raoult was using it in France and told you this is how you have to use it. You need to give it to them as soon as they're diagnosed and are really showing severe symptoms. Obviously, if they're asymptomatic and having no symptoms, they're probably not even in your hospital. But if they're there and they're showing symptoms and they seem to be going downhill, immediately start a protocol. We've been seeing protocols using hydroxychloroquine with azithromycin or with zinc, and having lots of success both ways, and sometimes just hydroxychloroquine by itself. But you were waiting to the last minute. But get this, and remember, it was hydroxychloroquine and azithromycin, I believe, was the protocol for Didier-Raoult and the zinc. And what we're being told is the hydroxychloroquine opens up the cell so that the azithromycin, the antiviral, or the zinc can kill the illness. That's how it works. But get this, when you look at this study, yes, the control group, right? Those that didn't get hydroxychloroquine, were they not getting anything at all? No, look at this. This is 31% of them were being given azithromycin, a product that is a part of the protocol, known to actually maybe be effective in helping with the COVID-19 infection. So not only are you only taking those that are on the verge of death and are probably going to die anyway, so you're going to have a really hard time showing that there was any effect at all, in your healthier group that did better, you're giving them a drug. It wasn't people that got nothing, which is what we're being told, that, you know, more people died that got it than those that got nothing. No, not true. So this thing is a total, complete disaster. But luckily, I'm not the only one screaming that from the top of the mountain. This was on Fox News this week.
It's unbelievable. That's not a study at all. They don't even list the dosages of hydroxychloroquine or azithromycin used. If a pill got dispensed from the formulary, Dr. Embody and the two other MDs on that study, the other rest are PharmDs and statisticians, are not clinicians. They're all trained in ophthalmology. Dr. Embody is a renowned macular degeneration researcher. I have no idea why he delved into this study, which isn't a study. It's a sham. I can't believe anyone took this seriously. There's not one dosage listed, cumulative or daily, of hydroxychloroquine or azithromycin, and people call this a study. I've never, ever seen an efficacy drug trial or study not mention the dose.
And there you have it. I mean, we looked at the same thing. This is not even a study. This is a total, you know, abomination of science, yet mainstream media is running with this. This is the story they want. They want, let me get this, they want a treatment to not work, even though it's working everywhere else in the world. They want to take this away from patients right now in America and say, see, stop the hydroxychloroquine now, because this really, really crappy study that said it was crappy from the beginning, and every doctor that looks at it says this is a disaster, said so. This is really bad science, folks, and it's really, really scary that it's come to this, that we are playing poker with people's lives based on our political affiliations and whose side we're taking. I want to go to Dr. Didier-Raoult, who is literally one of the greatest virologists in the world, has predicted so many of the discussions we've had on this show over the last 8 weeks. He came out, he looked at this study, he's furious. And this is just one small statement of a tirade he's been on that, well, we never got the still, then let me read it to you. We've been putting a lot of stills together the last minute. Still being, for those of you that don't work in television, that thing you're reading on the screen, let me read it for you. This is what he had to say. In the current period, it seems that passion dominates rigorous and balanced scientific analysis and may lead to scientific misconduct. And this article is an absolutely spectacular example of this. Basically saying the bias in this is incredible, how poorly handled it was. And then really quickly, I want to point to something that's just a little bit off topic, but also very interesting. In Italy, it is now being reported that people that take hydroxychloroquine for other illnesses on a constant basis, look at what they're discovering here. The Italian Society of Rheumatology studied 65 patients on long-term hydroxychloroquine for RA and lupus. Only 20 patients tested positive for COVID-19. There was no ICU and no deaths. This is a 90% reduction in infection rate compared to the rest of Italy. So clearly, this drug, now, and look at, I know a lot of you out there, I'm into natural health too. I'll probably get a vitamin C injection, but I'm not telling you to do that, because if you do that, you get kicked off of YouTube. Tons of studies showing that that is very effective. But we're talking about hydroxychloroquine here. We're talking about the fact that people that take it on a constant basis are not getting the illness. That tells you something. It also shows us exactly what the study showed us all the way back in 2005. Not only did it seem to stop the virus, it could actually prevent the virus. And so you have this really ridiculous study that has now got everybody changing their minds. All right, let's change gears now. Let's stay with the idea. I'm asking you, do you think there's a bias? There is a product, however, that Tony Fauci does seem to like. Now remember, the hydroxychloroquine is past its patent, okay? It's a generic drug. It costs, my understanding, is like $5 or $6 a pill. No one can make any money on it. So when you think about funding things and the funding that goes to the National Institute of Health and things like that, you got to think nobody wants hydroxychloroquine to be the answer. Huh? How much is it? 50 cents. Sorry, I went Imperial College on that and totally overbloated the number. 50 cents a pill is what they get from hydroxychloroquine. And remember, the FDA is now saying, we don't want you using this, only if you're in a hospital. Now, by the way, if you're pregnant and you happen to have heart disease and COPD and you're on your way to a malaria-ridden country, take this product and pop it like candy because we're not worried about it. But if you're dying of coronavirus, we're not going to give you a prescription, and we're going to wait till you're about to die to even consider whether you should get it at all. That's what's happening here in the United States of America. Sad, but true.